Hi, and welcome to InjuryGuru.com. I'm Carla Schimmelfinnig, registered physical therapist, and this series of videos I'm going to show you is all about treatment for some painful, stiff fingers. So if you have some arthritis or tendonitis in a finger or fingers, then this program may be helpful for you. It's so common. We look at our parents, grandparents, and we see the disfigurement in their fingers and knuckles sometimes, how their fingers are just stuck in a bent position, and that's just from years of wear and tear. Some of that's just hereditary, but I want to show you if you're in the beginning stages of that and you're just starting with that stiffness and soreness and swelling, then I want to show you some things that you can do on a daily basis to help prevent that stiffness that becomes permanent, and you have those really enlarged knuckles or bent stiff fingers that just don't bend or straighten anymore. So I'm putting this series of videos up this week, all in honor of my friend Bob, who I saw in a restaurant just a couple weeks ago. And he has been to his doctor. He's been diagnosed with arthritis in a finger or two, and he happened to show me his hand, so I could see the swelling and the stiffness there, and I could hear and see the pain that he was having on his face and in his voice. So Bob, these I'm putting up here this week just for you, so make sure you start with this program. And if you are viewing these videos and I'm describing the situation that you're having, then you too make sure you view these videos and get started on this program and see if we can't decrease some of that pain and stiffness and swelling that you're having. If you are viewing these videos though and you have recently had an injury to a finger or fingers, and you're having a lot of sharp pain, a lot of swelling, you're having some redness, so extreme redness and heat, and maybe even some numbness, you can't grasp or pull on anything, then I want you to go see your doctor, because you may be dealing with something from an injury. You may be dealing with something that is not arthritis or tendonitis, and something that needs attention. So do yourself a favor and get to see your doctor. For this video, I want to start with what the treatment that I want you to start with every time you do this particular routine during the day. And what you're going to start with is either some ice or some heat. Now, this is one of the few exceptions where I say you can use ice or heat. It's really up to you and what you tolerate and what you prefer, what feels good. So, with arthritic conditions, and something that's been going on for a while, and like I said, you've been to the doctor maybe and he's diagnosed you with this, so you know this is something that you're going to be dealing with, or you just suspect that you have some arthritis and you're finding you're dealing with this for a while, then really ice or heat will work. It's all your preference. When you use the ice, I want you to do this at least twice a day. And you can, the ice you only need to use for about 15 minutes. You can use crushed up ice is best. Just put that crushed up ice in a baggie, and that way it'll form around the finger or fingers and knuckles real well. Let's see, I want you to put a layer of something, so a thin layer like a thin washcloth. You can put that ice inside a pillowcase so that you have one layer between your skin and that ice. It's going to get real cold, it might get tingly, stinging, and then feel numb, and that's all pretty normal. Again, you only need to do that for 15 minutes. You don't need to do it any longer than that. If you use heat, you can actually Google making your own hot packs, and there are some good videos out there. I don't have time to show you all that, but if you have your own heating device, you can use that too. Just make sure you're familiar with your heating device so that you don't end up burning yourself. You can use that heating device, whatever that is you're using, for up to 20 minutes, and again, you can do that twice a day, but you can do both of the heat and the ice more often than that if you feel like it's working and you have some time. You can also alternate that heat and the ice, but for this program, it's important every time you do this that you start with that ice or that heat. and then I want you to move on to some other stretches and exercises that I'll show you. So make sure you view the other videos in this program. There's just 3 more short videos that you need to view, and get started, and let's see if you can't change that painful, swollen or tight situation in the finger or fingers that you've been having.